Nursing 345, Evidence-Based Assessment. The objectives for this week include understand the use of diagnostic reasoning and clinical judgment, discuss the importance of high-level assessment skills, describe expected physical, psychosocial, cognitive, and behavioral milestones of a patient on the basis of developmental stage, assess the basic characteristics of cultural and steps to cultural competence, define the meaning of common nonverbal modes of communication, and assess the behaviors that are considered in an assessment of a person's mental status. Point of entry in an ongoing process. So first we're going to talk about assessment. Assessment is you need to collect subjective data, which is what the person says about himself or herself during history. Objective data is observed when inspecting, percussing, palpating, and auscultating patient during physical exam. The database is formed from these elements, plus the database also includes a patient's record and laboratory studies. There are certain steps of the nursing process. First, we would collect the data from multiple sources. We would review the clinical record. We would interview the patient. We would obtain a health history. We would perform a physical exam. We would also do a functional assessment and a cultural and spiritual assessment. We may have consultations, and also we would review the literature. So for the nursing process, first, interpretation of data by identifying clusters of cues as to make inferences. You need to compare cluster of cues with definitions and defining characteristics. You need to validate the inferences based on findings. You need to identify related factors, and you need to document the diagnosis. You should identify expected outcomes related to patient individualization. You need to ensure outcomes are realistic and measurable. You need to specify short-term and long-term goal measurement criteria. Planning. This is when you would establish priorities based on meeting identified patient care goals, develop outcomes, and set time frames for meeting the proposed outcomes. You need to identify relevant interventions and utilize interdisciplinary healthcare team members in the care planning process for the patient. And also you need to document the plan of care. Implementation is when you determine patient readiness and involve patients in the healthcare process. You need to review planned interventions with interdisciplinary healthcare team members to facilitate collaborative effort. You need to utilize principles of delegation, being mindful of supervision and evaluation, and you need to counsel the person and significant others. You would refer for continuing care, and of course you would document the care provided. Evaluation, you need to refer back to the established outcomes and evaluate the individual's condition and compare actual outcomes with expected outcomes. You would summarize the results of the evaluation. You need to identify reasons for failure to achieve expected outcomes and take corrective actions to modify plan of care. And also you need to document evaluation in the plan of care. So for critical thinking, you have critical thinking principles. You need to proceed through sequential steps from novice to expert. Incorporation of experiences provides foundation for development of clinical practice. You need to utilize a multidimensional thinking approach to interpret data, using an organized, systematic assessment format. You need to validate and confirm findings based on non-judgmental interpretation of data and check for accuracy and reliability of data. You need to cluster data information to support evidence as well as rule out inconsistent clinical findings in terms of the differential diagnosis. And you need to distinguish relevant signs and symptoms. There are levels of priority problems. The first level priority are emergent, life-threatening, and immediate problems. The second level priority would be next in urgency, requiring attention so as to avoid further deterioration. Third level is important to the patient's health but can be addressed after more urgent problems are addressed. Collaborative problems, this is an approach to treatment that would involve multiple disciplines. Evidence-based assessment. Current and best clinical practice is based on research standards focused on systematic reviews of randomized clinical trials. It's utilizing evidence-based practice in conjunction with provider experience. By doing this, the evidence-based practice with your experience will lead to better health outcomes for patients. As educators, we need to foster a culture of evidence-based practice at both undergraduate and graduate levels that will assist to make evidence-based practice the gold standard of practice. The frequency of assessment. Interval of assessment varies with illness and wellness needs. Ill people seek care because of pain or abnormal signs and symptoms. This prompts an assessment, which would include gathering a complete database or emergency database. You would need to screen history for dietary intake, physical activity, tobacco, alcohol, or drug use, and sexual practices. Counseling for injury prevention, substance abuse, sexual behavior, diet and exercise, and dental health may be included. Routine periodic examinations might include the following services for preventative health care. Screening history for dietary intake, physical activity, tobacco, alcohol, drug use, and sexual practices. Routine periodic exams may include counseling for injury prevention, substance abuse, sexual behavior, diet and exercise, and diet health. Routine periodic exams may include immunizations, or it may include multivitamins. An example would be multivitamins for folic acid for females capable or who plan on pregnancy. For well persons, our opinions are changing about assessment interviews. The annual checkup is vague. What does it constitute? Is it necessary? Does it sometimes give an implicit promise of health and thus provides false security? Timing of formally accepted procedures is now variable. For example, annual pap test. Same annual routine physical exam cannot be recommended for all persons because health priorities vary among individuals, age groups, and risk categories. There also may be age-specific charts for periodic health exams, and this is a positive approach to health assessment. It's defined lifetime schedule of healthcare organized into packages for specific age groups. Each chart lists a frequency schedule for periodic health visits and preventative services for the specific age groups. These services include screening factors to gather during history and age-specific items for physical exam and laboratory procedures, counseling topics, and immunization. Age-specific charts focus on major risk factors specific for that age group based on lifestyle, health needs, and profit problems. Shifts emphasis from an annual physical exam toward rational and varying needs for assessment. It incorporates health promotion and disease prevention at every health visit, not just at one annual physical exam. Health education and counseling are highlighted as a means to promote health. A holistic model of health assessment must include culture. A holistic model of health care must include culture. Inclusion of heritage assessment is of paramount importance to gather meaningful data and intervene with culturally sensitive and appropriate care. With the rapid increases in numbers of individuals from diverse cultural backgrounds in the United States, a concern for cultural beliefs and practices of people is increasingly important in healthcare. A serious conceptual problem arises as nurses and physicians are expected to know, understand, and meet needs of people from culturally diverse backgrounds without formal preparation for doing so. International interchanges are increasing among nurses and physicians, making attention to cultural aspects of health and illness an even greater priority. Efforts at cost containment result in hospital populations composed of people with increased acuity, shorter stays, and earlier discharges than in the past. Nurses must make faster, more efficient assessments. Nurses are required to go to people's homes for follow-up assessment and diagnoses. First-rate assessment skills grounded in a holistic approach and knowledge of age-specific problems are required of nurses.